Well, a very pleasant good morning. It's 11:08 at WPSL 1590, the talk of the Treasure Coast. And wow, checking in from the Grand Poobah's office of Century Park Harbor Place. The one and only, Mr. Jack is back in town. How are you?
I am great. How are you?
Doing fine. How's the coffee?
It's still brewing over there.
You gotta have the slowest coffee machine in the world.
Well, it's made to order Keurig, so yes, it can be a little slow sometimes.
Well, you take care of your guests, huh? That's nice.
I mean, I prefer my Red Bull, but he likes coffee, so
Red Bull. Oh God. Well, I guess with all the gallivanting you do, you need that stuff, you know.
I know. Sometimes last week I was at our support center in Cleveland, Tennessee, so outside of Chattanooga. Next week I'm at a conference in Orlando, so just a world traveler.
There you go. All right. Well, now, as far as the conferences and stuff now, are they in person? They still kind of half and half?
No, this one's in person. It's the Florida Healthcare Association conference. I am the vice president for our district. So we go to that in Orlando next week. So Sunday through Thursday, and then I'll be back. So yeah, another long week.
So does that mean you will be the president next year?
No. I will continue to be vice president as long as they need me to, but I doubt I will ever move into that president role. Nope.
You know, why not? Just another title, right?
Yeah, no. With my position with Century Park and then being in school full time, no, I can't do it. I cannot take on one more thing.
Well, sure you can. Just another PhD program after that? Yeah, piece of cake.
Nope. Turned in my last term paper for this term last night. I was like, I'm done. I need a break.
We could call you Dr. Jack.
Whew. Nope. That's still a little ways off.
Oh, so how did the Vets Conference go on the 21st at Harbor Place?
It was good. We had quite a few people. Majority were current residents, but we did have some outside people that came in. Dwayne always does a fantastic job talking about VA and aid and attendance and how he can help and the forms you need and all of those sorts of things. I actually was sitting down with him the other day. Pat and I were discussing a future resident, and he knows the forms and what they're going to kick back for, like more than anybody I have ever seen in my career. So he does a fantastic job.
Yeah, I'm still in the state of shock that the VA says nothing about this. They keep this rather quiet.
They do. But it's out there that VA aid and attendance is available for people who need assistance with their daily needs, whether it be by private sitter or in an assisted living, long-term care, all of those sorts of things. So it's out there. All you have to do is apply for it, and they'll be able to tell you before you even apply how your current asset levels are and what they need to be at in order for you to qualify for that benefit.
That sounds good. All right. So I see you have a guest there.
I do. So today we invited from across the street, I say across the street, it's really across the parking lot, from Life Care Centers of Port St. Lucie. This is their executive director, Cole.
Hi there. Nice to meet you, Greg.
Good morning. How are you?
Doing very well. And yourself?
Doing fine. Yep. And actually going back probably, almost before you were born. We both sets of moms were in your place at one point or another after hip falls and stuff like that. So yeah, you guys did a marvelous job. Yeah,
And they still are. I've only been there for 3 months, but that facility is running quite well at this time.
There you go. So what's it been like for you?
Oh, really? It's just been getting used to the Florida weather more than anything. You know, I moved out here from Washington State on April 1st, just in time for summer to hit.
Yeah, well, okay. Now, where are you from in Washington?
Most recently, I'm coming out of Whidbey Island in the Puget Sound.
Oh, come on,
I
man.
know, God's country out there.
Oh. Oh my gosh. Well,
I know.
I used to when I back in my ESPN days, that's when the dinosaurs roamed the planet. The LA Kings used to have their summer practice on Victoria Island.
Is that right?
That was an amazing couple weeks. I mean,
Yeah.
oh gosh. So now, was your island near Anacortes up around
Yep. You could come through Anacortes, go over Deception Pass Bridge to get down onto my island, and I'm sure you've driven it a time or two.
Actually, my uncle lived on Anacortes. So yeah, wow. Small world.
Yes, sir.
Yeah, well, the weather's kind of identical if you kind of double your figures in
Yeah,
Washington.
in every way.
Yes.
You figure coming from the Northwest, rain, and then you end up being out here in Florida and you're soaked to the bone between the car and the house.
That's right. Yeah.
The humidity lately has been awful.
Yeah, it has. But welcome. Our grandkids, our two grandkids are in Spokane, so they're on the desert side of
Good for them. Yeah, I spent some time out there. That's where I got my administrator and training program completed with Regency Pacific over there. I did 9 months in Spokane. Yep.
All right. Yeah.
Really.
Well, you're coming from a beautiful state. There's no doubt about it. But you're
That's
coming
where it is.
to an amazing place. It's going to be exploding population.
Oh, 100%. From what I hear, there's about 1,000 moving here a week or something silly like that. And that's just
Crazy.
Space Coast, Treasure Coast. That's not the entire state. So I can only imagine what the rest of the state's doing.
Yeah. It's and what you'll find is that the economic bullseye, according to the Florida Chamber, is right here on the Treasure Coast for the next 40 years. So
Sure.
it's
I'm
going to
sure.
continue. It is going to
Yeah.
continue. Yeah.
Excuse me while I go pack my house.
Well, are you getting offers on it already?
Right.
Like 3 times the value.
Yeah, I just moved in. I already got 3 flyers in the mail for people wanting to buy my house.
Yep.
Crazy.
Oh yeah, it's nuts. It's absolutely crazy. So,
Yeah.
well, welcome aboard. And so now, was this the first Century Park facility that you'd been at?
We're Life Care, so affiliated, but not necessarily related.
Oh, okay, I got you.
Yeah.
Okay.
Yep.
Same owner, 2 separate entities.
Yeah.
There you go. Okay, gotcha. Yeah, I knew it was
Right.
the same owner. Yeah. Okay.
But yes, absolutely. This is the first Life Care that I've worked at. Life Care is in all 50 states. They're nationwide. They've got, they're, I think if not number 1, they're number 2 in the country.
It's over 300 buildings.
Yeah, they're right up there. So I've been with them for 3 months, coming out of a facility, a company up in the Northwest that's only 3 to 4 states wide.
So, wow. So
Yeah.
what's the difference that you've seen so far in 3 months?
In 3 months between where I came from and where I'm at now,
Yeah.
The Life Care model, they just have a lot of support. We're down here in the Southeast Division in Port St. Lucie, and between my operations, clinical management, marketing management, field controllers for the financial office, I've got divisional, regional support that I'm in contact with, if not daily, twice a day, that are just assisting to stabilize operations and ensure that, the Life Care's mission and values are being enacted throughout the facility. So there's great oversight by the company, and we're definitely not, left out on an island in our facility as a lot of other companies may do to their nursing home administrators. So.
Yeah, I think that's amazing. And Jack, of course, you guys work hand in glove with Life Care.
We try to, yeah. We try to sell our campus as a continuing care campus, since we have the 3 different aspects from independent living to assisted, and then over to Cole's building for rehab or skilled nursing. So Yeah, it definitely adds a benefit to our campus. The ability to say, look, you have the capability of transferring or transitioning from step to step to step. Whereas you go from here or you do a straight assisted living, as your needs increase, they may not be able to take care of your needs, or you may have to transition again over to skilled nursing. So just having that on one campus is a definite marketing tool.
And the beautiful thing about sharing the parking lot, and that marketing tool is the river flows both ways, right? So with the care continuum, you have independent to high needs from hospital down to at home alone. And so whether they're, like Jack is saying, coming from home to independent living to assisted living and then up to skilled nursing, we also see a lot of the reverse action where you have somebody ends up in the hospital with a broken hip, gets rehab, they're not able to get back to their prior level of function, and then they're able to move down a step into the assisted living to achieve more independence than they were with us prior.
Yeah.
Do many people that you mentioned the river coming back, and that does make a lot of sense, especially with broken legs, broken hips type thing. Do many people get back to like independent living from?
Yeah, I would say
care?
80% of our short-term rehab stays are going home or home with temporary caregiving assistance, with the home health agency where they have a nurse come in once or twice a week. They'll continue to seek therapy at home once or twice a week. And then they'll be back to their prior level of function at home. It's just those isolated cases, the 1 in 10 that do need that higher level of care, or in our case, lower level of care after their rehab stay.
Yeah, I mean, the ultimate goal is to get them back as close to what they were prior to whatever the incident is. It's not always feasible. So like Cole said, I mean, there's those isolated incidents where they can't. It's been so severe that they need to go to an assisted living, or in some cases, straight into skilled nursing. But the idea is to try to get them back to the state they were in prior to whatever the incident is.
How do you handle people that are basically here by themselves, that they moved to Florida and there's no other family down here? How does that work?
It's difficult.
I'll bet it is.
It depends on the situation. I mean, there's always different family dynamics going on. And sometimes it's an unfortunate situation. Sometimes you have children who, even though they live in New York, are very much part of mom or dad's care. They're flying in and out. They're on the phone all the time. So it just depends on the family dynamics and the situation. There are times where they're in the situation, and as soon as they discharge from rehab, the children move them wherever they are. So it just, like I said, it depends on the situation and the families.
Wow. Yeah, that's it. I didn't think about that, but in a way, all of our families are up in the state of Washington. So yeah, that would be difficult.
Yeah, if they're independent living, typically if they can get back to being at independent, the children will leave them there until it's a time that they need a little bit more care. It's not uncommon for an independent living resident that doesn't have local family to choose to go to a different to wherever their children are, to be in the assisted living portion or the skilled portion, just because it's easier for the family. But it's not always the case. We have some that were in our independent have moved straight over to assisted living or even to the skilled side, and their family does not live here, but this is their home and they're not going to move them from that.
So I do have to ask about the economies of scale, if you will. How expensive is a life care facility? And it's
Yeah, I'd say, typically we pre-bill by the month. So for a semi-private room at our facility, depending on if it's a 30 or 31 calendar day month, you're looking, right around $10,000 a month for that all-inclusive long-term care stay. Now, majority of the time, if you're ending up needing those services long-term, that'll become the forever home, in which case that money can be used as a spend down for a qualifier for Medicaid, where then Medicaid will take on the bill in your stead with just a share of costs monthly, which brings that down from $10,000 a month to as little as $600-700 in some cases.
Oh, yeah, that sounds quite reasonable to say the least. And again, it's private pay, right?
Well, that's what I'm saying about Medicaid. So that private pay dollars is 10,000, but then there are programs, there's long-term care insurances. Medicaid's a big one here in the state of Florida. That's a huge assist in that regard, in creating a safe way for adults to ensure that they have a place to live.
Now, does Medicare help cover if you have Medicare and Medicaid, or is it go strictly Medicaid?
It'll
at
be
that point?
strictly Medicaid at that point. Medicare will continue on as a benefit. But then, really those days are saved for more of the higher acuity need, right? We're looking at somebody in the long-term care setting that's needing that 24-hour supervision, med management, nursing services. And then they're going to be receiving room and board, meals, activities, and then social services as well on top of that.
Yeah, I've never been good at playing the market or anything like that. But the one thing I
You
did,
and me both, Greg. I'm
one
an
thing
operations guy.
one thing I did back in the late 70s, I think it was, or maybe early 80s, was buy the original long-term care policies for Carol and me.
That was very smart.
We still have them. So thank goodness for that. Yeah.
And I've seen some long-term care policies are great. They'll pay, I've seen upwards of $200 a day per person, but I've seen some that only cover $50 a day per person. So it just depends on the policy and the needs that are being met as to how the policy pays out.
Yeah, I'm close to that 200 line.
Yeah.
Carol's didn't take a couple of the upgrades, if you will, a couple of years ago. And actually the company we're with doesn't even offer it anymore. So
Most don't.
yeah.
Because they were realizing that people are living longer and longer.
Oops. So much
Yeah,
for the
so-
actuaries.
Yeah.
No, a lot of that is in part to our facilities.
Yep.
Is allowing folks to maintain that quality of life long beyond what we were ever able to see, prior to 1970, 1960. We're really maintaining high quality of life, bringing a lot of independence to living in those really, later years. People are able to enjoy them a lot more.
Well, and Jack, we've run into this at your place. I mean, to see people who are 100 years old and see, like when we do the Christmas Kids show at your place, and there might be 3 or 4 of them there. And I'm thinking, you've got to be kidding. It's amazing. And they're in great shape.
Yeah. We have an IL, an independent living resident that is 101 and still completely independent. And then we just, she passed away probably a couple of months ago now, but she was 104.
Wow. Amazing.
Yeah.
Absolutely amazing. And I'll bet sharp as a tack too. So
Oh yeah.
We're in the era of centurions. It's coming about,
Sure. So, okay. So how does that change your business models as companies?
So it doesn't change ours. We're a social model anyway. So the idea is that we're selling a lifestyle on top of that with some assistance, whereas Kohl's is a little bit different. Theirs is medical based. Ours is not. And so we, especially if you start talking with the state and things of that nature, we talk about social models. We're not considered a medical model. That's where we got into some complications during COVID, because there were some states that wanted to say assisted living was a medical model because you brought in home health and you bring in all this care, but those are third-party vendors. So it is very important that people remember that we are a social model ultimately, to give people the ability to socialize, but still get the care needs that they need, whether it be from aides or private or third-party services.
Well, and that's where Florida was a total 180 from where Cole came from in Washington, which locked everything down. And of course, our governor kept things open.
For a long time.
Yeah, it's diametrically opposed. So Cole, at your facility in Washington, what did you do?
We shut the door.
Yeah,
we
I'll
shut the
bet.
door and waited for the governor to give us the green light. And I would say that was probably the hardest thing we ever did during the whole time of the pandemic, is having to do these telehealth visits. You can only chat with your loved one on the phone through the window, things like that. And so the minute that they started to loosen those restrictions, the goal in the industry was almost unspoken, was to push the limits at every turn, right? And so every state is surveyed, and we all have investigators that come around to ensure that we're compliant. And so every time restrictions would loosen up in Washington, we'd push the envelope as to how far that meant we could go.
Yeah.
Right. And so if they were allowed to have a visitor, the initial opening up for visitation in Washington was we had to implement a system in which there was a dedicated visitation area that was deep cleaned in between visitation, where 6 feet social distancing could be maintained. And you had to maintain a certain number of you had to have set visiting hours and a visitation list. So if you were not allowed to take a walk-in. They had to pre-book their visitations. And so what we ended up doing was taking our main dining room, opening that up for visitation, and essentially saying we can have visitation from 9 a.m. until 3 p.m., as many as 4 families, as long as they maintain social distancing. And then the state came in and they said that's too many at one time, you have to reduce that down. So we're able to do, they said one resident per area. So now we had to have separate areas for separate residents. And so it just took a long time. And there's a lot that the major thing was the fear factor, right? Having been where COVID made landfall, and we saw what happened in Kirkland, and we even saw what was happening before we got the monoclonal antibody out there in Washington. It just spread like the wildfires we'd had the summer before, and it's just difficult to contain. And so that brought a lot of fear around. And I think that coupled with people's desire and need to ensure that they're compliant just allowed that to happen in our state. Whereas Ron DeSantis over here in Florida created what many people consider the last free bastion in the lower 48. Where I came, it was quite the breath of fresh air to walk into a facility. Now in our setting, in the skilled nursing setting, you still are required to wear a face mask, but there haven't been, and there are not any visitation restrictions in the state of Florida. I believe there were for between 2 to 3 weeks at the onset of the pandemic, but then, like you said, Greg, just opened right back up.
Yeah, it didn't take long. And then they signed the basically No Resident Left Behind Act, meaning that even if they had to go into a lockdown, each resident was allotted a certain amount of people that were basically free to come and go, so that we don't run into the same issues that we did last time with the socialization part of it as well. Even though we were on lockdown, people who were in crisis care, actively dying, on hospice, they were able to have people come and go. But that was it. So if a resident was particularly on our side, if they were just here because they needed socialization, they weren't actively dying, then they were stuck in the same position as skilled nursing, because they closed us, even the assisted living, down as if we were the same model.
Wow. Yeah, well, I remember the first couple of times I visited with you, Jack. It's over a year ago now. We're starting a second year this week, or next week, I guess, as a matter of fact. And you had everything. You had the eye scan, and everything else, the temperatures, and I have no problems with that at all. None whatsoever.
You would be surprised how many people do, though. Even though we still have to protect our residents, this is ultimately their home, and how you choose to come and go in your own personal homes with your friends and things of that nature. I totally understand. I'm not downing that at all. But I have upwards of 160 residents here, and my job is to make sure that all 160 of them feel safe. And so checking in through our front desk process, with our kiosks where they do your temperature, they ask you specific questions. That is all, it's all mandatory to make sure that I can keep them safe, including any guests still are asked to wear masks. They're required to wear a mask. Residents have the choice. This is their home. But guests coming in, they have to check in, they wear a mask. And particularly right now, St. Lucie County, the positivity rate just keeps going up. So we're being extra precautious.
Yeah, well, and we're not testing any. I don't even know of any testing facilities around. So, I agree. Well, Cole, when you were there in Washington, and you talked about the setup as far as visitors, were any children allowed in there or no?
Not for a long time, and we mainly did that. That was at our facility level. We chose not to allow minors in. And that was due to, all of the data out there that, a lot of the time, anybody under the age of 16, they could test positive, but they don't show any signs of symptoms, right? So that's what you get when you have this very vulnerable population that are the main targets for the disease. And then you have essentially everybody else.
Yeah.
Yeah. And like Jack was saying,
18 and under.
Yeah. Okay. Well, like Jack was saying earlier, Cole, I mean, this is your responsibility. All these people are your responsibility.
100%.
Yeah. That's especially during COVID had to be quite the burden.
It weighs heavy, right? And I'll be proud to say that when the pandemic first hit, I was down in Oregon. I'd been there for 8 months. We locked our facility down. We enacted some pretty stringent screen-in procedures. We transitioned our entry points to a intermediary building where our staff would change from their street clothes into facility provided scrubs and do their hand hygiene, their screening temperatures outside of our main facility, and then they'd come into the building. And so while we did have several cases come through, we never had a loss of life down there for the first year and a half. And then we got the monoclonal antibodies, and then we got the vaccine. And so, I think at the end of the day, that facility ended up only losing 2 of 60.
Wow. That's
throughout the course of the pandemic, where you had some of the other facilities, and I think it's not necessarily maybe had to do exactly with what we're doing specifically. It felt almost random over there at times where, you'd have one person pop positive, and then all of a sudden you'd have 30 people positive, and 15 of those would pass away, where some facilities would get lucky and they would just have 1 or 2 residents go positive, and then there wouldn't be much spread. So
yeah, and of course you had the ultimate nightmare in Kirkland. So yeah,
it was hard.
Yeah, and the bad part was, and like Cole said, it was so random. A lot of the cases we saw had no symptoms, and so they would get in with no symptoms, and then all of a sudden test positive, and then you're kind of backtracking, trying to figure out, okay, who have they been in contact with, and who have they been around, and where have they been on campus, and so you spent time more chasing your tail, trying to figure out things. If you were not diligent upon making sure everybody was following the proper protocols.
Well, that was the ultimate contact tracing. I mean, you had to do that.
Yeah.
Oh, well, hopefully, whatever this new stuff is, it's not going to be as deadly. I mean, that's the big thing.
They are seeing a decline in the deaths, and that is partly because people are building those antibodies and having those antibodies through the transfusions, and then having vaccines. And whether you're a vaccinator or not, that is completely your choice. But they are seeing there is a correlation with vaccinated, and that they are not having the major symptoms that unvaccinated had, all of those sorts of things. So I just encourage everybody, do your own research, look out. There is a new vaccine coming out. We were just talking about it last week. I don't remember the name of it, but it is not the mRNA.
Mm-hmm.
It's a tried and true method. So if it doesn't have any stem cells, anything like that. So that is coming out. It already has emergency approval. So I think you'll start seeing some of those that were against it because of religious reasons, things of that nature. This should eliminate some of that as well.
Wow, that would be good because, of course, there's a lot of, the deniers out there that just don't even believe that, the vaccines worked. But obviously, I mean, hey, look, I was around the college basketball team throughout the whole thing, 2 seasons, and I had to be vaccinated, and I had to get my boosters, and I had no problem with that.
Right.
I'm dealing with 18-year-old kids.
No, they're not going to die.
Well,
They're not going to be affected. They'll have a body ache and maybe they'll crack a fever, but those vaccines, they're a miracle for those residents that are living in our facilities, assisted livings and skilled nurses, right? Those vulnerable adults, comorbidities, over the age of 65, really susceptible, similar to the flu, susceptible in that regard.
Well, and like we talked about, did I necessarily think it was going to be a 100% cure all end all? No, I knew it wasn't. Vaccines are meant to help with something. Just because you get the chickenpox vaccine doesn't mean that you're not going to get chickenpox. Those things do happen. But I took the stance of I work with 65 and older, and I would not have been able to live with myself if I didn't get it. I got COVID, I gave it to a resident, and a resident passed away. I looked at it from a bigger picture, not so much as how is this going to affect me, but how is this going to affect the people that I'm around? And that's a key point that a lot of people leave out. I'm not going to be told what I have to do. Okay, but think about the bigger picture. Think about your community. Well, what does the community do for me? Well, that's not the attitude we need to have.
Yeah. Oh, yeah. Yeah. It's amazing. Well, Cole, how large is the life care facility here?
We're certified for, I believe it's 120 beds. We've got 117 actionable at this time. Oh no, so sorry. We're certified for 125. We've got 117 actionable beds, and currently our census is up around 109, 110. So we've got 4 openings. There's skilled beds at this time. Our long-term care side, we're on a wait list. I believe we only have 2 names on that wait list at this time. And that typically does move through pretty quick. Just with those transitions to lower levels of care and things like that.
Sure. Well, it sounds like you're pretty well full now. I presume then that doctors recommend that, folks go to your facility then for rehab.
Right. Everybody needs a written order to come into our building, whether that's long-term care or short-term rehab. Typically, we're getting those referrals straight out of the hospital for the short-term rehab side. And then a long-term care referral, that'll be a family member will come in, they'll want a tour coming from home, right? Or from an assisted living, whatever the case may be. If they want to transition to that higher level of care, to long-term care, they'll come tour the facility, make sure it's somewhere they want to be, and then they'll get a doc to request written order. So, or unless they're private pay, of course, if they're private pay, they don't need that order, but Medicaid's not going to pay unless a doctor says it's medically necessary.
Right. And Jack, when Pat or you do the tours, do you also go down to life care as well?
No, not typically. We talk about life care.
Okay.
We do lead them in that direction if they need it. But like you said, those are typically coming out of the hospital. So if someone is touring us, but they're going to rehab or they're in rehab, that's where we're getting the referral is more from rehab. Most of the time the hospital stay it's typically a 3-day stay, and depending on what the diagnosis is, they can get a stay in rehab, and then they transition over to us. It's very uncommon that I get a referral or a move-in directly from the hospital unless they're coming from another assisted living, or they were already looking at moving to an assisted living prior to their hospital stay.
Now, I remember, I think it was a Medicare number of X amount of days.
Yeah, you get 100 days per calendar year.
Okay.
allotted for a skilled stay. Medicare will pay 100% for up to day 21 and after day 80. So there's about 59 days in there that you'll either have to pay a share cost, or if you have a secondary insurance, AARP, Blue Cross, even Medicaid as a backer, they'll take on that copay after day 21. But yeah, you have 100 days, and then if you do use all of those, I believe you need a 3-month qualifier in order to renew those days.
Wow, that's amazing.
Typically, they try to get in and out of rehab within that first 21 days.
Yeah, I've been in the industry for coming on 5 years now as an administrator, and I think I've only had 2 or 3 cases of using up all 100 days, and those were folks that came in with less than 50, less than 60 days to start with.
Interesting. Wow. Yeah, it's this is the stuff that nobody sees, it's
Sure.
like,
Yeah.
they just see a facility, and you just think, wow, but there's just so much that goes into it. It's amazing.
Yeah. Well, and that misconception, and I'm sure Cole doesn't get as much on their end as we do, but that assisted living is a nursing home. There is a far cry of difference between assisted living and a skilled nursing facility. Skilled nursing facility does a lot more hands-on stuff than when we do in an assisted living. And so getting that knowledge out there and helping everybody understand is the key point that we have too.
Right. You're more of a condominium with those extra services such as dining and activities and group services, whereas we're like an apartment block with nurses 24/7 to make sure everybody's happy and healthy.
I like to refer to it kind of as skilled nursing is your intensive care unit, assisted living is the regular floor, and independent living is just an apartment.
Okay.
That's the best way to look at it. If you think of the hospital setting, and because that's what most people are familiar with, in your intensive care unit, that's a lot more nurses. There's a lot, you got one-to-ones, all that sort of stuff. Whereas on the regular floor, they don't come in as often. It's just basic needs. That's the same thing between assisted living and skilled nursing. It's just on a different level.
Interesting. So how many, you say common owner of these 2 facilities, how many of the facilities does he own actually?
All of them.
Of Life Care. All of Life Care?
Yeah. Mr. Preston is the sole owner of all of our buildings.
Whoa. Okay. Wow.
Yeah.
That's
amazing. And most of our campuses have some form. I know for us, most of them, I think 90% of us sit on the same campus with Life Care. There's only a couple that do not, and they're typically just a standalone independent living.
I think it's fascinating that someone like him would have had I would say foresight to think of something like this.
So the original thought process was not this big. Obviously, he needed a place for his loved one and didn't like everywhere that he looked. So he decided to just do his own. And he took his business sense from being a door-to-door vacuum salesman and has turned it into an empire, basically.
Wow, what a story. That's amazing. That is truly amazing. Wow. Yeah. Well, Cole, what's in the future for Life Care here in Port St. Lucie?
For Life Care here in Port St. Lucie, we've been around for quite some time. This facility, relatively new department heads. I'd say we got about 18 department heads. Of that, 9 to 10 of them have been in the facility for less than a year. We had a pretty rough survey 2 cycles prior. Our last survey, we did much better, and that was the month before I got here. And so really the focus is on stabilizing operations. And from there, ensuring, we want to be the best community partner that we can be between the hospitals, the assisted livings, and every person that lives here in Port St. Lucie, to be able to provide them the best service. Life Care's mission, Life Care's values, what they strive to be is the #1 in every community that they serve. And so that's the task that I've been tasked with, and the team that we have here right now. I have no doubt that we can accomplish that. From our marketing team that's out in the community. My marketer is Monday through Friday. She's out visiting hospitals, checking in on candidates, on referrals for the first 3 to 4 hours of her day before she even comes into the building and starts working on admissions. And then my case manager, she got a second social worker in there with her so that she could focus strictly on discharge planning and short-term rehab to make sure that those folks coming in from the community are able to achieve that highest independent living setting possible for themselves. So that's really the goal and the focus right now, is to ensure smooth flow, really avoid any obstacles and make sure that everybody's happy.
Well, okay, you mentioned surveys. Who surveys you guys?
So we're a federally funded facility. We accept Medicare dollars, we accept Medicaid dollars. And so that's going to be CMS, Centers for Medicare and Medicaid Services. They send out a survey team annually. I believe it's up to an 18-month cycle, but it's usually a revolving 12-month cycle. So they come in once a year, survey our operations and our clinical team to ensure that the building is within their guidelines. Most heavily regulated industry in the nation, and for good reason, right? Our customer base is entirely made up of vulnerable adults, and so we do need that extra oversight. I mean, we've seen it on the news, for the last 20 years, several instances of, neglect, things like that. So we just need to make sure that we're operating appropriately, and that additional oversight allows us to have a team come into the building annually and essentially give us a checklist of items that we need to work on and fix. And so that's one of the best tools that I have.
Jack, do you have something similar to that?
We do. Yeah, we're surveyed by AHCA. It's American Healthcare Association. I think about the acronyms there. The healthcare agency always confused me. But yeah, we're regulated. Ours is about every 2 years, unless there's a complaint survey where they come in and deal with a specific situation. But we just had ours this past March, I believe, and we're deficiency free. So it just depends.
Oh boy.
Yeah, I know, right? And so it's a good thing that they come in very often, like I said, those complaint surveys, because those complaint surveys are going to keep you on your toes in those 2 years.
Wow. I didn't realize that. We have to deal with the FCC, but it's like, as far as inspections, there would have to be something really grossly wrong with your operation.
Right. Well, you'd be surprised. Some things just kind of slip through the cracks, not on purpose, but things do happen. Everybody's human. And so you are constantly watching for those things. But we're also regulated, if you think about the county health department, things like that come through for our kitchens and the safety inspections and things like that. So we're still a business. And so those things do happen, and things do come through. So we try to be on our toes, and we try to keep it safe. Now, keep in mind, the independent living side has no regulation whatsoever. It is just like living in an apartment complex. We only thing we have to deal with there is Fair Housing Act. And so that's about it on that, except for the dining room and the kitchen, who are obviously regulated by the county.
Interesting. Wow. Cole, your building, I know as far as Harbor Place goes, they're hurricane rated, there are no evacuations during a hurricane. What about your building?
Yep, we're shelter in place.
Okay,
yeah, absolutely.
Good.
We're shelter in place. We don't know how funny it is, but I'll call it a funny story. Last summer, there was some pretty heavy rain coming through, and the retention pond in the back of the building had not been mowed and cleaned and taken care of. It's not on our property, so as much as it affects us, not much we can do about it. And so that overflowed and flowed into the facility just without the drain outlets and things like that. And so we had some, 2 inches of water in the building, since been abated. We actually just got our drywall actually today. The painters finished it. And so we've just been waiting for the city to approve our inspections and things like that. And so we just passed everything today. So we can finally take down our pardon the dust stickers. But, since that happened, we've learned a pretty big lesson over here. We've got some new troughs cut in. We've got some new storm water drains put in. That retention pond has been taken care of courtesy of Life Care and back billed to the owners of the property. And so that's not an issue that we'll be having in the future.
Well, if Jack just gets somebody to get into that restaurant, they fix that thing, right?
I know. It'd be really nice if someone would open that restaurant back up. I know it's been empty for a very long time though, so it would probably cost a pretty penny to get it situated all over again. But with that thought in mind, we are getting ready to reopen our bistro to the public.
Woohoo! I love that place.
In March, we will do a soft open March. In August, we'll do a soft open towards the end of the month. I'm going back in time here. And then September 1st, it actually becomes, I think it's whatever that Monday is. I think it's the 5th. We will officially open Monday, Wednesdays, and Fridays from 11 to 2. It'll just be bistro type stuff with paninis and soups and salads and cold sandwiches. But it will be reopening to the public. We're very excited about that. So be watching our Facebook page, our website. We're going to be doing a rebranding and a reopening stuff here pretty soon.
That's great. And by the way, your Facebook page is very nice. You guys do a good job updating the folks.
We try. We actually have an internal email system as well that we'd use for our staff, for residents and resident families, so that we can keep them updated. We use a program called Constant Contact. It's basically like an email that shoots out like Facebook, but it's great because I can load it in there. I can do one thing and it goes directly out to families. We also use what's called a call multiplier, which will do text messages, voice recordings directly to phones of people who want to know what's going on. So we use both of those when we're doing events. We're able to do mass emails, mass calls. So it really is, it's made things a little bit easier. It's amazing what we have learned during times of COVID of how you can still market from behind a computer without having to get completely out of the building.
Yeah, that's amazing. And it's wonderful that the bistro's opening. Now the back room open for like civic groups if they want to meet there. And
it is.
How do they do that?
All they have to do is give us a call here at the building and we can arrange that. Our bistro will be open on Tuesdays and Thursdays for small civic groups who want to book a small lunch. So it'll be open on Monday, Wednesday, and Fridays to the public. And Tuesdays and Thursdays, we will book luncheons for small civic groups as well. So we have lots of different rental spaces that you're able to use on top of what our current residents have here. We don't take anything away from them. For different events, if we have a resident event that's planned, they get top priority, but you are more than welcome to give us a call here at the community. You can shoot me an email as well, and I will get those information to you. We have a wonderful chef. Sylvia is fantastic. She has great catering menus, and so does, we call him Doc. Jeffrey, our sous chef, he is really good as well. So give us a try, give us a call. We'll be happy to kind of get it set up for you and figure out some things to help you get situated. The only things we don't really do right now are birthday parties. Obviously, I can't do evening events like that. I have residents that go to bed. So we try not to do those quinceañeras and big parties because we just can't do that. And with COVID times, we try to limit to the civic groups or business meetings.
Yeah, and I noticed that you didn't have a party for my 77th because there weren't enough candles.
I'm sure we could have found 2 7s to put on there for you.
Oh, brother. So what's coming up as far as community events, a la the VA type thing?
Yeah, so actually we're going to start having an open house every week. It's not every week, once a month, the first Saturday of every month. From 11 to 1, we're going to do a brunch in our dining room, and you'll be able to kind of eat and take a view of assisted living or independent living. But we'll start doing those on the first Saturday of every month. And then check out our Facebook page. I know we've been posting a lot on different events. Pat's been doing all kinds of stuff while I haven't been here getting things scheduled. And so I don't know all of them off the top of my head. I am so sorry. But check our Facebook page because we do get them posted on there at least a month in advance.
By the way, did Dwayne work on you about the padded room? I know he and I are fighting for the same room.
I'm sure we can figure out some way to pad the room for you. If not, we'll send you over to Cole. I'm sure he can.
Oh, yesterday for you, Greg.
you got a spot.
That's right.
It's right next to the Pardon the Dust sign. Is that
Yeah.
it?
Hey, that's coming on today. You won't even see it.
Been there, done that. So
And I went through 3 years of Pardon the Dust. So we are
You
done.
sure
We are done with Pardon the Dust signs around here. We've got a little bit left to do, but no more dust signs.
that sounds great. Well, Jack, how do we get in touch with you?
Yeah, go to our website, go to centurypa.com, take a look. You can actually view any of our campuses through that website. And then you can look at our Facebook page, Harbor Place at Port St. Lucie, or give us a call here at the building, 337-4330.
And Cole, how do we get in touch with you?
Well, you come on down 3720 Southeast Jennings Road here in Port St. Lucie, Life Care Centers of Port St. Lucie. You can check us out on the web, Life Care Centers of America, huge corporation, or you can call directly to the facility. Phone number is going to be 772-398-8080. And we are open for tours at any time.
All right. Well, you both have a good day. This is WPSL, Port St. Lucie.